Hello, thank you for joining us today for the latest installment in our Spectrum series, this one about pharmacy management. We have two outstanding guests today who are going to walk us through the ins and outs of pharmacy spending and cost containment. Our speakers today are Linda Riddle from she's a poverty educator, population health scientist at Health Economy. She joins us today from the Validation Institute, but she is a poverty educator and population health scientist at Health Economy, where she specializes in health policy and health data analysis for both the public and private sectors. She previously served as a board member for the Maine Community Health Options, and she holds a master's degree in health policy from the University of Southern Maine. She holds a Protecting Human Research Participants credential from the National Institutes of Health. We are also joined by Greg Sanderson. He is the Chief Operating Officer of AlignRx Consulting. Greg has extensive experience and understanding of the complex pricing methodologies commonly used within the pharmacy industry, and his knowledge of PBM benefit contracts and pricing allows him to work with clients to squeeze a tremendous value out of pharmacy benefit managers. Prior to joining AlignRx, Greg served as the PBM manager at Health Now New York and was responsible for underwriting, financial oversight, and forecasting for the entire self-insured drug book of business. And I'm Teresa Vincent. I'm the product manager at Nova Healthcare Administrators, and I will be your host for this session. Thank you for joining us. Greg and Linda, we are very excited to have you here to talk about this exciting topic. And Nova Healthcare Administrators is sponsoring this series. We are, if you're not familiar with us, a third-party administrator. We've been around for just about 40 years this year, and our priorities are to manage trend, reduce healthcare spend, and improve health plan performance. So this series is the way we're showing all the different components of healthcare of how we do that for our clients. And we use the framework of the spectrum of health plan performance management opportunities as the way we talk through that. So if you think of your company, your benefits, your clients' benefits, if you're a broker, as that white light source that comes into a prism, a good TPA partner is really going to be that prism that shows you all the refractions of the different colors of light, all the creative solutions that are within that white light coming into the prism that then turn into this rainbow of network, telehealth, wellness, medical management, pharmacy management, which we're just discussing today, and then coming up next, benefit design tiers and reimbursement. If you missed any of the initial sessions, you can always go back and find them on demand. But today we're going to focus on the pharmacy management spectrum of solutions. And anyone who's ever spent any time working on pharmacy knows it's very complex. There are a lot of options. And within pharmacy management, we have it broken out in these gradients of the more traditional model that we think of the integrated PBM that really looks at your highly managed prescription plan. It could involve mail order or a specialty RX company working with the PBM or embedded within. And then there are things like medication adherence support. So that's your basic PBM model. That's what you can expect to get from any sort of PBM. We're also seeing this emerging model that's more consumer directed. So it's offering incentives for cost savings based on consumer choice of pharmacy or lower cost alternatives, and that often includes shared savings with members. So that's a model we've seen that is getting to be quite popular with a lot of groups, and that's a PBM, but also a little bit different. But what we want to talk about today is a little bit more of the transparency-based PBM. So we want to talk about how to make your pharmacy benefits much more patient-centered, data-driven, and focus more on real cost savings, not just looking at rebates or how money gets kind of shuffled around as a discount. So Greg and Linda are going to talk us through these different components about choosing a pharmacy benefit manager that is really accountable and that is solidly based in data and accountability. So we're going to start first by talking with Linda about the work that the Validation Institute does to go out and validate pharmacy benefits managers. So with that, I'm going to turn it over to Linda.
Thank you. Thank you for that great introduction. You can advance to the next slide. So the Validation Institute exists to help purchasers select data-driven, data-proven performers. So I'm not even going to recite the problem because I think everyone here knows it by heart. But the Validation Institute, by validating the performance claims of providers, is meant to help purchasers avoid bad choices, bad outcomes, and decision paralysis. So whereas in the past, a purchaser was focused on or faced with a mile-high pile of options and not a good way to differentiate between them, Validation Institute is meant to help with that process. So the Institute itself has 3 different focal points. One is around educating benefit purchasers about making better informed decisions. So there is a series of courses available that result in a certified health value professional designation. The next part, which is what I'll be talking about today, is validating vendors' marketing claims or verifying that they can perform as promised. And the last part is connecting benefits buyers with proven performers. Go ahead. So some of you might be old enough to remember the trust but verify slogan. So that's sort of a tagline for the Validation Institute, that the independent verification that we offer. So you know when you see someone with a validation seal that a team of objective scientists have looked at their claim, looked at their data sources, and verified that they have portrayed their impact accurately. I think the next slide, yeah, goes through those steps. So this is a process that we've tried to make as simple as possible, but the first step is that the vendor comes to us, say a PBM, and says, here's what we've calculated. Here's how we have taken data, say, from the prospective client and compared it to data from our database, for example. So in a PBM context, that would be a fairly straightforward way of calculating savings. Except that, as Teresa mentioned earlier, there's all these specialty RX and different, I think they're called carve-outs, that can have impacts that you didn't necessarily anticipate at the beginning. So we have a PharmD on our team to help us to scope those things out. Our next step after we look at what the vendor has already done is they put that all together and submit it to us. It's not in a formal peer paper necessarily, although sometimes we do get something along those lines. Then we review that. We don't actually analyze the data again. We're reviewing how they did the math, essentially, and whether the assumptions that they have made along the way, and all math includes some level of assumptions, are reasonable and based on, say, published results from other similar programs. And then the last step is that we report on what we can validate. So this might be compared to going for a bank loan. So the vendor might come in and be looking for validation that they have had a $1 million impact, for example, but we can only validate that they've had 750,000 of impact. So we do kind of rein them in. Now, what I've just described is looking at a savings validation. We have a separate type of validation for transparent PBMs in which we have a set of standards that transparent PBM contracts must meet, and we validate that their transparent contract meets those standards. So that's a little bit different, somewhat similar in terms of the discovery and review and everything, but a little bit less math intensive. I think you go to the next slide. Oh, and as I mentioned, the Certified Health Value Professional designation. One of the courses within that is Optimizing Drug Spend. That is taught by our PharmD person, and she's very high energy, and it's a very enjoyable class. I have taken it myself.
I have also taken it because I'm a CHVP, and it really is an excellent class. The whole program is actually great, and walks you through those 4 validation steps that Linda just discussed for any vendor that you want to bring on board. So it's a great program.
Great. There you go. Thank you.
Thanks, Linda. So finding the right PBM partner, this is where Greg really has a lot of expertise and is going to walk us through the questions and things that you should be asking so that you make sure you're finding that right partner once you've had a chance to validate that the data is accurate and that they're going deeper than just the marketing pieces. So Greg?
Great, thank you. So just to start, to give an overview of our company and what we do, we're AlignerX Consulting, and really we focus on helping health plans, employer groups, TPAs, really manage their spend, and then also from an employer group perspective, find the correct PBM partner. So our team consists of everyone from underwriting to clinical to account management. We're located out of Buffalo, New York, and say combined experience is pretty significant. We have former directors from health plans along with former directors of underwriting from large PBMs. So we have a good range of experience to really help us evaluate a PBM, also evaluate the proposal that's being provided for an individual employer group, and then really walk our clients through the process of what to look for, what questions they should be asking, how to make the right decision for their PBM partner. So I think we can go to the next slide. So I will preface this slide by saying I was limited to 1 or 2 slides, right? When we go through the process, we have a questionnaire that's over 100 questions. So it is a very complex space and requires a significant amount of questions to really dig down and get these PBMs to agree to what they are responding with, I would say. I think with this list, it really is a good starting point. I think that this is going to point you in the right direction on what type of PBM you want to go to, what your options are in the market, things along those lines. So the first being, is the PBM a transparent or traditional pricing PBM? Now, a majority of PBMs will offer both traditional and transparent, but there are a lot of PBMs that are now strictly transparent. And I think that is gaining steam in the industry. I think that for too long, there's been too many games being played on the traditional side. And employer groups are seeing that, and they're just trying to find new ways to save costs. There are many options out in the market. I think, depending on size and preference, each employer group or client, there's a right partner. We just have to figure it out. So I think if they are transparent, one of the things that Linda was mentioning is validation, right? So you want to ensure that if this PBM is saying that they're transparent, that they truly are a transparent house. There are too many PBMs that will market as transparent, but if you really dig deep into their practices, they aren't truly transparent, I would say. So it's important.
Yeah, Greg, I just want to say I've worked through a few of these, the transparency contract standards validations, and we, in our report, which is public and up on our website, we will highlight where in their contract that they have a contract provision that's not entirely transparent, like they have a subcontractor that is not necessarily transparent.
Right.
So yeah,
It's a great resource, and I think it's really important, right? Because you want to make sure that you're picking the correct partner. The costs in the pharmacy space are going up year over year, and if you do not have the right partner, it's going to be hard to curb those costs. So I think that really is the first question, right? The second question, and really what my team does, is it's throughout the proposal and the bidder process of an RFP, there is contractual pricing guarantees being offered. So on both the transparent and traditional, this should be the case. And really, you want a guarantee in place for both your discounts, rebates, dispensing fees, admin, all of the components that drive into the plan spend. I think it's an important question to ask, because if you don't ask what the guarantees are, you could find yourself in a situation where you're not getting guaranteed, right? There are PBMs out there that will put numbers on a spreadsheet, but if you read the small detail, they're not truly guaranteed, whether they be at a book of business average or things like that. So really, unfortunately, in the RX space, the devil is in the details, and you really need to ensure that you are reading all of the small print, reading through the contract, and asking these types of questions. So, and second on the pricing is rebates. Now, rebates are, you'll hear about them in the news. They are a hot topic, I'd say, right now. And I find it very important that they are all passed through down to our clients. These rebates are earned on the claims of your population or utilization, and there's no reason why you should not be receiving all of those rebates. Now, I understand there could be some administrative fees that the PBM could retain, but I think a majority we ensure that are being passed on to our clients. Because these rebates are in the thousands of dollars now, and it really helps curb that cost for a employer group. Next question is what type of cost containment programs does a PBM provide? I think this is an area that doesn't get spoke about a lot. I think it really should be more focused on from an employer group, because these types of programs can really help drive down spend. We've seen a lot of specialty copay programs or carve-out programs like Linda was mentioning that we've found success with our clients. I think the specialty space is something that employer groups should really be focused on and figuring out ways to curb that, because for our book of business, an average employer group, it's 55% of their spend on average. So it really, and if you think about that, it's only a handful of claims that are driving 55% of the spend. So if we can find a way to contain those claims, whether it be through a copay program or utilization management program or whatever can be done, I think it's important to present those to our clients. And a lot of our clients do enroll in those. There's little disruption and the savings is significant. So I think to Linda's point, she did bring up a good point though. You know, there are a lot of programs where there are unexpected costs with some of these, whether it be, you know, less aggressive to allow claims to go through in the program or whatever it is. We are also vetting any vendor that we're recommending to our group, whether it be a program offered by the PBM or a third-party vendor that strictly focuses on these types of services that can be bolted on to the benefit through the PBM. And I guess that leads into the second point on this is, does the PBM allow third-party vendors? There are some that do, which is great because it really provides the flexibility that employer groups should have. If there's a program out in the market that can save a group 30%, they should be able to use it instead of being handcuffed into an in-house program provided by the PBM, which we do see sometimes as well. So I think before making a decision, it's important to know if you're allowed to utilize any third-party vendors that may help drive significant savings. On to the next point around, this is more a contractual thing, and this is where we get more into the weeds of how the games are played in the pharmacy contract. So this is, how are the key financial terms defined? What is a brand drug, a generic drug, a specialty drug, a rebate? You'd think that it would be the same across every PBM, but that's not the case. Every PBM has a different definition in how they categorize these drugs. And it's so important because how a drug is defined then leads into how the drug is priced, right? Or if you earn a rebate on it, or what the discount is. So ensuring that the definitions are, let's say, up to code is a big piece of what we do, because there's a big domino effect of those definitions that many just don't really focus on, and it could really have a significant impact on a group spend and contract. So we ensure that we have in-house definitions that we like to roll out to the PBMs, but if the PBM wants to use their internal definition, we will adjust it to make sure there are no games being played from an optics standpoint. And the last is, this is more on account management, right? How many employer groups does the account executive manage? I've seen some PBMs where it's in the hundreds. And just thinking of that, you know how well your responsiveness is going to be, how well your management is going to be of your spend, because these account executives are your front line, I'd say, contact to get any member issues resolved, get any programs rolled out to your population. So if they are managing hundreds of clients, you're not going to get the best assistance. So I always ask my clients, what's more important, pricing or account management? Because that can lead you in two different ways. A lot of the big box shops, they are great in a lot of areas, but sometimes, because they're so large, if you are a smaller employer group, you're not going to get the attention that you would get with maybe, say, a mid-sized PBM that is more customer service facing or focused. So I think that's an important part. And then, do they offer guarantees around their service? Are they guaranteeing that they will provide a response in a certain amount of time frame? Are they guaranteeing that any member issues will be resolved in a certain time frame? That the call center will answer the phone? That, putting guarantees is a good way to keep a PBM in check from a service perspective. So I think that is an important question to ask your PBM partner. And then on the right, I have a bunch of additional questions. I'm not going to go through them, but I think, there are some more detailed kind of questions that you may want to consider when evaluating your PBM. They all will have an impact on your downstream cost. And I think, again, these are some of the few important ones, but there are many more that we ask when we do our evaluation. So, yeah, I think, it's just important to ask questions and not jump to conclusions with a PBM, because there are a lot of downstream costs that you should be considering before making that right decision.
Right. It's very easy to look at the marketing materials and see, oh, I'm going to get great savings, but Linda, yeah, exactly.
Right.
Linda can walk you through how to actually understand if those are real numbers or if they're just paper numbers. Greg has provided an excellent framework of the questions you need to ask. And I think that's really important, because if you're not that familiar with PBMs, or you just know from the glossy marketing brochures, you really don't know where to start or what questions to ask. And it's really helpful to have a starting point. I think just if you say pharmacy benefit, it can feel very intimidating to a lot of people that are not that knowledgeable about pharmaceuticals, because yeah, and you see how expensive it is. You see how the cost is going up every year.
It's very complex, and what I say is that's by design. Unfortunately, this industry has gone to a point where they've made it so confusing that people are intimidated by it. And that really makes people not want to ask questions because they feel insecure, where they feel like they should know these answers. But the PBMs, they make their contracts 100 pages long for a reason. They change the terms for a reason. They really will make things so confusing that you kind of just put your hands up and say, okay, I'll sign the contract and be done with it, without really understanding, the financial impact of that and what it really means to your members and your bottom line. So, that's what we do on a day-to-day basis. And Linda as well, I think it's important. Unfortunately, companies like us are needed in this industry at this point, because it is just so complex.
Yes, and Nova we consider ourselves PBM neutral, so it's kind of like BYO PBM for our plan. We don't really have one that's affiliated with us specifically. But through our sales process, we do try to understand what each client's tolerance for changes. We try to engage in conversations. We try to direct people to resources such as these, so that there really is an understanding of how all these pieces work together. Also, how the PBM works with the TPA is very important. And Greg, I saw that as one of your additional questions. You know, what data is flowing back and forth, and how are you really getting a full picture? We have a lot of medical management practices, which we actually talked about in our last webinar, and that can tie in very nicely into a lot of the pharmacy pieces as well. It's all part of the whole, even though it may be different vendors coming to the table. You know, it's just one patient with one profile of health when you really break it down person by person.
Exactly.
So we did open this up for questions, even though this is a pre-recorded webinar. We did ask for questions from individuals before recording. So we did get one question that I just want to throw out there that either one of you can answer. The question is, what are the latest cost containment strategies related to stop loss, benefit design, et cetera, for specialty and gene therapy drugs?
There. Greg, you're much closer to that than I am.
Yeah, so I'd say on the specialty space, like I mentioned earlier, what we've really seen an increasing trend of is these specialty copay programs, where they're maximizing the assistance provided by the manufacturer to help lower the plan costs and also benefit the member because it'll lower their copay. So outside of that, there is some utilization management. Formulary helps drive some of the savings, but it really, I'd say the biggest trend is those specialty copay programs for the specialty space. From a gene therapy perspective, we really haven't seen much. When these drugs were released, there were, a lot of the PBMs, they rolled out some programs to help mitigate the cost for an employer group if they did incur one of these claims. But it was more like a stop loss program. It wasn't any way to contain it. It wasn't any way to avoid it. It was just basically a fund that would help assist with the cost if they incurred a claim. But outside of that, I spoke to our chief pharmacy officer this morning. She hasn't really seen much. Now, Linda, if you've seen anything, I'd love to hear it. But
no, not in terms of cost containment. On the contrary, there's drugs coming out, say injectables, that are replacing, quote unquote, replacing orals. So the injectable is, more costly, requires a physician, maybe not a whole visit, but at least the patient has to go to the office. They're not self-injectable. So that's what I would be watching for, are new drugs or new delivery avenues that are replacing old ones at higher cost.
And I think another thing that just came to mind is biosimilars are gonna, I think, become a more prevalent thing in the market. Historically, the big manufacturers have been able to kind of ward off these biosimilars, but what we've seen is, Semglee is now a preferred product for ESI, which is a big step. Once the big PBMs start referring a biosimilar, I think that it's going to really open up the market. I know Humira is coming out with one, which should really, Humira is 20% of all of our client spend. It's just a giant drug in the market. And I think once the biosimilar is released, hopefully these PBMs can price it correctly and then really drive that utilization to these lower cost alternatives, which will really help the bottom line for the employer groups.
All right, well, I think that covered the question. That was the only question that we got in, but anyone who's watching, if you have any additional questions, feel free to email Nova, and we'd be happy to share those with Greg and Linda and get back to you with a response. The next Spectrum Series webinar is going to be in March of 2022, so in just about a month. We're going to be talking about benefit design tiers and all the ways you can structure your benefit design to get the most out of your plan. So that will be the sixth episode of our Spectrum Series. So we look forward to seeing you there for that. If you don't already follow Nova on LinkedIn, that's a great place to learn when that has been posted. Greg and Linda, thank you so much for your time today. I think this was really insightful and helpful for people that have all these swirling questions about PBMs. And thank you for everyone who watched today or even in the future. Thanks, everyone.
Thank you.
Thank you.